All right, so with this cone beam radiograph, we were able to see something that we would never been able to see otherwise with a traditional radiograph. First thing, we were able to determine that she has this massive amount of decay on the backside of the tooth. The other dentist that saw this literally was going to try and do a root canal on this tooth. The decay has actually eaten down into where the roots split apart. This tooth also has on it a very large abscess on the distal root. Also on the mesial root, there's a large abscess as well down under here. So, so this was a challenging tooth in that sense, because we know that this is just going to break apart when we start to take this tooth out. The other thing though that's really great is that you're able to see in 3 dimensions. So looking at that tooth just from the front, from the side view was one thing, but looking at it from a different view tells a whole other story. So look at these roots down here. Look at how they curve, and the back root, which is normally one solid tooth, or one solid root, has 2 separate roots, and the roots are completely hooked. Look at this root, making a complete hook in there. And so on the front root as well, look at the front root, how this thing hooks as well. So when we took this tooth out, preparing for the surgery was really important, because we were able to see things ahead of time, so we didn't have complications. And during the surgery, of course, as expected, these teeth with hooks on them, they broke off down in the bone. So I knew exactly where they were going to break, right here, and on the front root right here, and that's exactly what happened when I was taking the teeth out. And so I knew where they were at, I knew where the nerve was at, so I wouldn't be disturbing the nerve. And the surgery went beautifully. I was able to get everything out, get the infection out, and then get the root tips out, all 3, in a very expeditious manner, because I knew where everything was at before I started the surgery. And absolutely, without this technology, you would think I could do a root canal on this tooth and save this tooth, as the other dentist told her, but that was not true after we saw the x-ray. All right, so we have this wonderful new piece of technology in our office, which is called the Quick Sleeper. And this is a completely painless anesthetic system. I love it because it requires me to make an evaluation beforehand regarding the amount of bone that's in here. But basically, when patients have large abscesses like this, these are very difficult to get numb because the acidic level. If you're doing a block on this back tooth, which means to do treatment on this, you would normally give an injection way in the back part of their jaw back here and hope that it gets this main nerve numb down here on this abscess. But the fact of the matter is that the human body is very complex and very difficult to get numb sometimes. There are a lot of different places that nerves can go into this abscessed area, and so it can become very difficult to get numb. In fact, most abscessed teeth are very difficult to get numb. However, with the Quick Sleeper, which is a completely painless and anesthetic system, I put anesthetic down in the cancellous bone, which is this spongy bone here. You don't feel anything, and it gets profoundly numb all the way around, including abscess tissue. It's the most fantastic way to deliver anesthesia. I'm the only person in Utah that's using this right now. I'm one of 25 doctors in the United States that are using this right now. So this is an amazing piece of technology that we have in our office. And basically what I'm doing is just injecting anesthetic into the bone. It's completely painless and really a great way. The other thing that's really neat about it is that, especially on a tooth like this that's down on the bottom, normally when you do a block anesthesia, injecting anesthetic way back here at this really large nerve root, you get the tongue numb and the lip numb at the same time. So this patient had no numbness in their lip or their tongue, only the teeth that are right around where I injected. So really a great treatment to be able to do. Here at the Essential Dentist, we have this technology and we're using it right now. If you are afraid to have an injection because of pain or otherwise, this is the office for you. We've got a painless anesthetic system that you can take advantage of here. If you've had problems with fear or problems getting numb, this is a surefire way of getting a tooth numb painlessly.